Hello, everyone, and welcome back to the 2023 Global Health Leaders Conference at Johns Hopkins. My name is Siam Rezwan. If you're watching a recording of this session, today is August 9th. And as the closing speaker of our conference, we are so honored to be featuring the United States Surgeon General, Dr. Vivek Murthy, for our fireside chat today. Vice Admiral Vivek Murthy was confirmed by the U.S. Senate in March 2021 to serve as the 21st Surgeon General of the United States. As the nation's top doctor, Dr. Murthy helps to advance the health and well-being of all Americans and has worked to address critical public health issues. Dr. Murthy, welcome to the Global Health Leaders Conference at Johns Hopkins. We are delighted to have you as a part of our program today.
Well, thank you so much. I'm really glad to be with all of you today.
Thank you. So to go ahead and start off with our session, we know you've done a lot of incredible work in public health and medicine, and as you are a role model for so many of the students in our program. Could you share a bit more about your journey to where you are now in your career?
Well, sure, Sam, I'm happy to do that. And look, I'll just tell you, if someone had told me 20 years ago I'd be here talking to all of you and I would have been wearing this uniform and doing public health work, I probably wouldn't have believed them. And the truth is that, very few of us can predict where we go in the future. And I was one of those people who was never really good at sticking to 5 or 10-year plans. And so I think that one of the things that I knew early on, though, is I had an interest in health. And that was because of my parents. My mother and father both ran a medical clinic in Miami when I was growing up. And I spent a lot of time in that clinic. I didn't understand a whole lot about the science, what was happening, but I would see the human dimension of what was taking place there, which was people coming in worried and anxious about their health and their families, and then leaving their appointment feeling more comforted and knowing that they had a partner in their healing. And even as a young kid, I could appreciate just how wonderful that was, and I wanted to have a part of that in some way, like when I grew up. But apart from that sort of nascent interest in health, I didn't have a lot of contours when I was growing up to what I would do. I thought about going to medical school, but then I got interested in a whole bunch of other areas like history and economics and English literature along the way. What brought me back to health was actually public health work. Was working on HIV programs in India in the 1990s, which was one of those unexpected detours that my life took. I seem to be in a constant unexpected detour, by the way. So if you are out there and you find yourself taking such detours, just know it's not all bad. But what it was, I'll actually just tell you about that since it's illustrative, I think, of what I think is actually come to be more and more important to me, which is not like how much you plan, but how clear you are on what matters to you and about how good you are at embracing the opportunities that life brings your way, expectedly or unexpectedly. But I was a freshman in college. My sister was a freshman too. She was 18, I was 17. We were just, trying to figure out what this college thing was all about. And I got a call from my dad actually one day. And he said, there's this guy, this philanthropist who's interested in giving money to a cause, but he's not sure what the cause is. And so if you have any ideas that you want to pitch to him, you should think about it. And I had never thought about pitching an idea to a philanthropist, building some, that was just not part of my thought process. But I began to think about it, and I recall that I had spent the summer before in India before starting medical school. Before starting college, and had realized that HIV was a growing problem there. I had shadowed a doctor there with my sister just to kind of understand a little bit about how they were thinking about HIV and whatever. It was just one of those summer, in between seeing relatives kind of things. I just hang out and try to get some exposure. And I came back, but I found myself thinking about that after my call with my dad and realizing that HIV was this growing problem in India. But it was a time when it felt like the government and the private sector didn't want to engage on addressing the issue. It was sort of looked at HIV as a Western problem, and it was not really acknowledged much in India. So we found ourselves wondering, hey, could this gap be filled by young people? Could students actually step up in this time of need and actually be the community educators, the sources of prevention that the country really needed. And so we started building a youth movement, a peer educator youth movement in India, and then ultimately came and built chapters of that in the United States. But that whole journey started because of that random call, that I got from my father that led us down this path. And it became an 8-year journey of building a nonprofit organization with branches in 2 countries that ended up changing how I thought about public health, but also how I thought about my own journey in health. Since then, I'll just say that there just have been a lot of, a lot of time moments of searching. It was in that experience of working on HIV that I found real fulfillment. I found that I was working with a small group of people who shared a similar set of values, and we were working to try to make people's lives better in some way at scale. And that was exciting to me. It was fun, but there's not exactly a graduate program you can sign up for that, right? You don't major, there's no major that like constitutes that kind of work. And so I finished college, went to medical school, but spent all this time in medical school to be a little bit lost, not quite sure what I wanted to do next. And I went to business school to learn how to run and build effective organizations. But I ended up in residency also lost, just chasing that feeling I had had when I was 17 years old, working with this incredible group of people and building a student-led movement. And so it just, my point in sharing that is that sometimes you will have these moments in your life where something feels just right. You feel inspired, you feel excited, you feel energized, you feel like you almost like don't want to go to sleep because you have so many ideas that you want to work on, or you want to like move to the next stage of execution on this idea or this project, or you want to stay up really late talking to friends about it. Those moments are really golden. Like that is life telling you something incredibly important, which is about what lights you up. And it's what lights you up in life that will ultimately lead you to have the most fulfilling experiences and build actually and create the most important contributions, to others that you'll make in your life. But that standard is really important. And if you haven't had that kind of experience yet, I would just encourage you to keep seeking it out by trying different things, because like I know that I've read about this gathering and about so many of your backgrounds, and I know that this is not a group of people all of you who want to just go through the motions and live life and be able to say at the end of the day, I got married, had my 2.2 kids, had 1.6 cars, and and I lived a fine life. Like I sense that the people in this group want to make a contribution to the world and also want to find fulfillment in the process. And to do that, it's important to find those moments of clarity where you find yourself lit up, and to actually just look back in your life and say, what were those moments, as brief as they may have been, and what do they teach me about what I want to chase next? I'll lastly say this, because this has become a long answer to a short question. But this question of what to chase in your life, I think, is one of the most important questions that I think of as an orienting question, right? If you decide that the most important thing for you to chase is status, right, that'll lead you in one direction. If you think it's power, that will lead you in a different direction. If it's service and contribution, if it's making other people's lives better, that may lead you in a different direction. And these aren't all mutually exclusive. You can do great service to the world and and do that while building and accruing power, and wealth as well. And there's nothing wrong with that. But knowing what's leading you, what's the most important thing that you're chasing, that is actually important. And I'll tell you, the people spend their entire lives not having clarity on that question, and it can lead them down all kinds of paths, but ultimately not to fulfillment, which is what is really important for you. You can do more in one day when you are deeply fulfilled and excited about what you're doing than an entire month where you're totally uninspired and unengaged in your work. And so think of your inspiration as a force multiplier. And so it's worth seeking out, most moments of inspiration. It's worth figuring out what truly inspires you. That's what ultimately has led me throughout my life. But it wasn't easy. It wasn't like I knew this, from the get-go. I figured it out the hard way through many years of feeling lost, of wondering whether the messages I was receiving from others in society about what I should be chasing were in fact what I should be doing, even though they didn't quite feel right to me. And that happened many times, like when finishing residency, trying to think, hey, should I do a subspecialty fellowship? Should I be a cardiologist, which is what I was interested in? And everyone around me was saying, yeah, you should do cardiology, because our joke in medicine was that I had the three big risk factors for being a cardiologist, which is that I was male, 6 feet tall, and Indian, which is turns out there are a whole bunch of folks who fit that demographic who go into cardiology. But the truth is, like, my heart wasn't, no pun intended, but it wasn't like truly in that pathway. And what I really, but I didn't know what the alternative was. So I had to take time to just search. And I took a part-time job working at the hospital and teaching, and a part-time job just literally searching, learning, working on ideas. I used to have this big yellow pad of paper that I would write ideas on, and most of those would end up in the trash. But toward the end of that year, like, I remember having an idea for building a technology company that I was really excited about. So I pursued that. Like 2 years later, I had this moment of inspiration where I felt excited about building a movement of doctors around the country to actually create better health policy so we could better serve patients. And so I ended up building an organization called Doctors for America from that. So it was chasing inspiration that led me to where I am. It wasn't always easy. There are many times in between, or gaps, where I felt lost. But I'll actually say that this is why the community becomes so important. And this is why it's so helpful and important to have a couple of people in your life who you can talk to about your journey honestly and openly, because they will help lift you up during those moments when you feel lost. They will help remind you that being lost doesn't mean that you're unworthy. It doesn't mean that you're wasting away your potential. It doesn't mean that you're never going to find something that inspires you. It's part of this journey that we're all on together, even though our paths may be individual, where we're trying to find what truly speaks to us, recognizing it is in those moments and on those paths that we can make the greatest contribution to the world.
Hi, Dr. Murthy. My name is Priyal, and I'm the Associate Director of the conference for GHLC. And thank you so much for telling us about your journey. It's like very inspiring to learn that your journey has also been filled with questions, explorations, and those like little golden moments. Just recently, you published a new Surgeon General advisory calling attention to the public health crisis of loneliness, isolation, and the lack of connection in our country. On the surface, these issues may be surprising, or at least not the first things that come to mind when all of us think about public health. Could you tell us a little bit more about this crisis of loneliness and why you have released this advisory?
Yeah, no, thanks for asking, Priyal, about that. I suspected if and maybe I'll just ask all of you, just since so many of you are on video, just by show of hands, how many people know someone in your life who has struggled with loneliness over the last year? Yeah, so almost everyone, right? This is a nearly universal experience. And the reason I actually decided to focus on this as a public health issue was because, really, for a few reasons. One is because, like, I was familiar with loneliness because I myself had struggled a lot with loneliness as a kid. I was, I was just one of those people who, was shy. I was introverted, and I wanted to hang out and make friends, but it was a little tough for me to do so. And I also felt different a lot. Like, there were very few people who looked like me or shared my cultural background in the school that I grew up in. Like, people always, used to, people. Anyway, there was a lot that happened when I was a child. So that feeling of isolation was familiar from childhood. As a doctor, I saw so many patients who were struggling with loneliness and isolation too, which was unexpected. It wasn't something we learned about in medical school. But when I was it became Surgeon General the first time under President Obama. That is actually where I came to see that this is not unique to my own experience, but there were people all across the country who were really struggling with a sense of loneliness. And I came to see that it was a global phenomenon as well, and not just in small numbers, but in large numbers. So the two big points that I wanted to make in this Surgeon General's advisory we issued is, number one, that loneliness is exceedingly common. 1 in 2 adults in America report measurable levels of loneliness. The numbers are even higher among young people who struggle with the highest rates of loneliness, regardless of how connected they are by technology, and in some cases actually because of the way in which we've come to use technology, particularly social media. But the other thing I wanted to make sure people understood was how consequential loneliness is for our health. I'll tell you, when I was growing up, I thought loneliness was just a bad feeling. I thought, yeah, this is something I should be able to deal with. I guess it's me, the reflection of something that's wrong with me. I felt a sense of shame around it, so I never even talked to friends or my family or my parents about it at all. Um, but what I wanted people to know is that it turns out when we struggle with loneliness, especially a chronic sense of loneliness or isolation, what we think of as social disconnection, and that actually increases our risk for depression and anxiety and suicide. It also increases our risk for physical illness, for heart disease, for dementia, for premature death. And there are biological mechanisms why this is the case. But the bottom line is loneliness is not good for our health. On the flip side, when we are connected with one another, it is not only good for our physical and mental health, but it turns out communities that are more connected are more economically prosperous. They tend to have lower levels of violence. They tend to be more resilient in the face of adversity, like hurricanes or tornadoes or other events. And so that cohesion, social cohesion in a society, but also social connection in an individual level, this is really just intrinsic to who we are. And it's how we evolved over thousands of years to be in trusted relationships. But something has happened in the last half century or so, particularly in the last 10 to 20 years, where the forces around us have dramatically altered the social fabric of our lives. And it's happened almost like right there in front of our faces, but we haven't really thought too much about the consequences of it. And now it turns out the consequences are quite profound because we look at the polarization and division, political polarization that's cropping up in many countries around the world. That also is much more likely to grow and to fester when people are feeling disconnected from one another. A simple thing I try to remember is that it's hard to hate people up close. If you actually know them, if you know a little bit about their lives, if you recognize that you have some shared interests, even though you may have different opinions on things. But when you don't know other people, when you're disconnected from them, it can be very easy for outside forces to manipulate you into thinking that they're evil or they're the enemy or you should be against them. And we see that happening again and again and again online. So I believe what we need right now in society is a movement to rebuild social connection and community, a movement to stitch together the social fabric of society, which is our most important safety net. And this is not something that government alone has to solve. In fact, I think it is us as individuals and community organizations that can have a real outsized role in helping to address the lack of community and connection. And it starts with us. Like, what are we doing in our individual lives to actually focus on people, to focus on our relationships? Are we checking on others in our life, recognizing that it's hard to tell from the outside who is struggling? And sometimes, though, just simply checking on other people can help them feel less alone. Are we prioritizing in-person time with others? Are we making sure that we are looking for opportunities to serve others, whether it's coworkers, students, and in our class or members of our community, recognizing that service is one of the most powerful antidotes to loneliness? This is what we are called to do again. And this is why I issued this advisory, because loneliness, the challenge of loneliness and disconnection should not only be a public health priority, but it should be a broader priority for all of society. And that's what we have to mobilize around.
Thank you, Dr. Murthy. So it's clear that loneliness is an incredibly large problem that definitely needs us to come together to address. And as our program is for students around the world in grades 9 through 12, could you tell us a bit more about how loneliness uniquely affects young people and what are some strategies that young people can use to combat loneliness within this age group?
Yeah, no, appreciate that, Siam. Look, I do worry a lot about young people. People like in teens and young adults seem to have the highest rates of loneliness in society. And look, I think there are a few reasons for that, which lend themselves to understanding what potential solutions could be. I think one of those is that we have, while technology has been a real gift to us and it's helped us do a lot of really important things in society. It actually has changed the nature of our relationships such that we are interacting often less with people in person, having fewer conversations in person, and more of that time is shifted to online interactions. Like if you grew up with digital media, as many of you did, that may be the world and it might not seem that abnormal or unusual. But I would encourage you to just look at the lens of history for a moment and to recognize that as human beings, we evolved over thousands of years without the technology that we're using today. And one of the things that that means is that the way that we learn to interact with each other was often based on cues that you could pick up in person, right? So facial expression, body language, the tone of someone's voice, uh, even their silence, and sort of what was happening around their silence. And those are things which, if you're texting alone, you can't always appreciate, right? Sometimes being in person is really the best way to communicate really well with someone. The more input you can get, voice, face, facial expression, body language, the more it helps you strengthen and build a real connection with somebody else. So that has fundamentally changed. But I also think that the other thing that is contributing, I think, to this sense of loneliness is, I think, something that we have done more broadly as a society to I think, lose a lot of the core values that I think help make us strong as a society over hundreds of years, which is that the core value of people looking out for each other, having each other's backs, taking care of each other. That's a value that I worry has been increasingly lost as society tells us more and more that success is about like how much wealth, power, and fame you can accrue for yourself, right? And you should be chasing that. You should be chasing the fancy internship, the fancy college that you can get into, the high-paying job. That's how, and you should be building your brand. Like it actually makes my stomach curdle a little bit whenever people say they feel like they need to focus on building their brand, because that, to me, that is emblematic in some ways of the fundamental challenge we face here, which is that we really thrive as individuals in a society when we recognize our interdependence, when we don't see it as a weakness to depend on other people, but recognize we need help from others and they need help from us. And when we're helping each other, that's where we go. That's how we go far, and that's how we sustain like our progress. So to address this, just a few things I would suggest. One is, I think all of us need what I think of as tech-free zones in our life, right? Whether that is time at dinner, whether that or meals, whether that's time when we're hanging out in person with our friends, whether that's time before in the hour before we go to bed and throughout the night. But we need time where we aren't distracted by technology, because it's not just that technology can take away from in-person interaction. It's that like we now understand that when you're constantly scrolling on social media and looking at what other people are saying about you, about other issues, you might feel like, oh, I'm connected to them because I see what they're saying. But it's actually not the same. And I hear all the time from people who say they think they go on, their feeds to scroll just to see what people are doing, thinking they'll feel more connected to them. And they ultimately end up feeling worse because find that they're comparing themselves all the time to other people's lives that they're seeing displayed online, even though they know people are, showcasing the best parts of their days and their lives. Still, they can often feel worse by comparison. And sometimes you can also feel like, hey, people are doing all these things without me. How come I'm being left out here? Which is a very common feeling people have as well. So there are some ways in which social media and technology can be helpful for us, no question. But we need spaces in our lives that are free of technology. The second thing I'll mention is that we need to pay attention to how we feel when we use technology. And this is one thing that gives me a lot of faith, is that I think your generation is actually remarkably smart and insightful about technology, about both the positives and the negatives of technology. And I've actually gained most of my understanding, not just from research articles and data and talking to experts, but from doing roundtables with middle school and high school students to understand their experience of technology. And so here too, I think it's important to pay attention. How do you feel while you're using it and immediately afterward? And if you're not feeling better about yourself and about your relationships, that should be a red flag to you, that you maybe need to rethink how much time you're spending on those platforms. And then the last couple of things I would suggest to you is make it a point to spend some time either in person or hearing someone's voice, talking to them on the phone each day, other than the people who are in your household itself, like whether that's a friend that you call, a cousin that you call up, somebody in school that you actually have a conversation with in person, face to face. This might sound like a really basic thing. You might think, well, I'm interacting with people all day long. I don't mean just a normal interaction. I mean a routine interaction where you're just saying, hi as you pass by in the hallway. I'm talking about actually just sit down, even if it's for 2 minutes, and just say, hey, how are you doing? I just want to check in on you. Like, what's going on in your life? Are you doing well? How's your family? You know, if you know something about their life, that they were in a competition recently, or they're trying out a new sport, or they're like learning the violin for the first time, like I just ask them how they're doing. Ask someone else about their life, and then pause to actually listen. If you do that once a day, even if it's for 2 or 3 minutes, that will materially change how you feel. It'll make you feel better, but it'll also help others to feel better as well. Um, and the final thing is, look, if you are struggling, if you are feeling like you're dealing with anxiety or with depression or with loneliness, it's causing you real pain inside and you don't know how to manage it, never feel afraid to ask for help. Sometimes it can feel really like you're the only one who's struggling, especially when you look around us and it seems like everyone's got this perfect life and they've got it all figured out. Let me tell you one thing for sure that I've learned in the last 46 years: nobody has it all figured out. All those people who look like they've got all their, you know, stuff together and life is just going well for them, they're struggling in a lot of ways too. You just don't see it, right? Like they may be having real problems with their mom or with their dad. They may be struggling with a substance use disorder. They may be struggling with imposter syndrome. Like we just don't know all the struggles that other people are going through. But something magical happens when you reach out in the way that we're talking about and ask people how they're doing, which is you give them an opportunity to actually talk about it. But with all that said, reaching out for help is never the wrong thing to do. We have a crisis line now in the United States, 988, which is like 911 for emergencies that you can call or text if you or someone you know you care about is having a mental health emergency. But seeking help, whether it's talking to your parents, talking to a close friend, telling me you're struggling, there is no shame in that because we are all going to struggle at some point in our lives.
Yeah, I totally agree. Interaction is like very meaningful for all of us. However, many times connectivity with people of different age groups, whether that's within your family or within your society, is like very difficult. So we know that intergenerational connections can provide valuable support, companionship, and guidance. How can we foster stronger ties between older adults and younger generations to kind of combat this loneliness problem and promote a mutual understanding between like everyone?
Yeah, it's such a good question. And I'll tell you that I've been thinking about this a lot on a personal level as well, because my parents are getting older and you know, I'm aware that like my time with them is not indefinite, right? And so I find myself thinking a lot about these intergenerational ties and how to strengthen like my relationship with them. But I have kids now also, and I'm thinking about how to strengthen my relationship with them because I don't want them to grow up and kick me to the curb being like, dad's not cool. I don't want to hang out with him anymore. That may very well be true. Dad is not cool. Probably has never been cool, but I do want to have a good relationship with them. Look, I think one thing that when I think about like patients that I've taken care of over the years in the hospital and about the regrets that they share with me about their life, especially when they're looking back over many years and they're facing perhaps the end of their life and are asking themselves, what really mattered? What did I do right? What do I regret not doing? The regrets that surface the most are regrets around relationships. And they're often about relationships with kids, relationships with parents, and relationship with your spouse, right? And so this crosses generations. And one of the things I think that's really important to do is to recognize that, yes, look, all of us are going to get frustrated at our parents from time to time. We're going to feel like they don't understand us, understand what we want to do, that they grew up like in the dark ages, that they don't get like, you know, modern day realities. Like we're going to feel all of that, like with our parents. But the thing like that I found that's really important is also to recognize that approaching our parents with some grace and forgiveness is important too, because our parents are evolving as well. They're learning, they're growing, they're encountering a world that's radically different from what they grew up in. They're seeing their kids go through it. And there a lot of times our parents might be scared about what they see their children encountering. They may not know how to manage it. And that fear can manifest in different ways. Sometimes as parents being overprotective, sometimes as parents getting angry or flying off the handle more. Like every parent handles this differently, and they're not all perfect by any means. But being able just to recognize that and to reach for some forgiveness and grace with our parents is important. The one other thing I would just recommend with regard to parents is just to recognize that parents actually are a very interesting treasure trove of stories, right? The wisdom, there's a lot of wisdom in their stories. The wisdom that you get from their stories may be different from the wisdom they take from their stories, right? But if we never hear their stories, then we never will get that wisdom. And one thing I will tell you for sure is as you get older, you will find yourself, you will get to an age where you wish that you had talked to your parents more about their stories. We all say, gosh, yeah, I used to hear that story about my dad walking uphill both ways to school, like, in the blizzard, even though he lived in a tropical area. And I remember hearing all these stories and yeah, whatever, there's just corny parent stories. But there are stories behind those stories, right? And so one of the things to do is I would see if you can approach your parents every now and then with a question where you can drive the story that they tell you. You might want to ask them, what were you scared about when you were in elementary school? What did you think you would actually do when you were in middle school? What was the thing that you really believed in high school that turned out to be totally wrong? Or whatever question it is that you would find meaningful that would lead to a story. Think about a question like that, and I would ask your parents, or it doesn't have to be your mom or dad, it could be a mother figure or a father figure in your life. And then listen to the story that they tell you. I would even encourage you, if there's a story they tell you that's really striking to you, to write it down, to record it in a voice memo, to write it down in a journal. But that will be something you will treasure, like in the months ahead. Like I'll tell you, the next time I see my parents, which will hopefully be in a few weeks, I'm planning to record like a bunch of stories with them, because I've come to realize just how much wisdom parents have to share. Again, the wisdom you take from their stories may not be the wisdom that they necessarily elicit from it. When I do speak to groups these days, I actually tell a lot of stories from my parents, but I'll tell you, they're not the stories my parents thought I would tell. Like, I'm sure they're just like throwaway stories my parents mentioned here or there in reaction to some question I asked, and they didn't think those are the most important stories of their lives. But you know what? I actually found deep meaning in some of those stories. So those are the stories that I tell. So those are really, really powerful. And I'll end this question just by telling you a quick anecdote from one of those conversations. I remember talking to my father once when I was younger, just about his father, and my grandfather, my paternal grandfather, grew up in a really small village, a farming village in India, and they were very, very poor. They didn't have, I mean, when I say poor, I mean like they didn't even have enough money to buy footwear for the kids. So they were barefoot a lot of times. They had to share a pencil, the 6 kids, during the school year, because they didn't have enough money to buy pencils. Like they were very, very poor, and they had to, they would dilute their dal, their grains that they made every night, so that there was enough, to put in each kid's bowl, because they didn't have enough to afford dal. So despite that, like I remember my father just telling me in an offhand sort of way, he was like, your tata is a term for grandfather that we would use in our culture. So you say, your tata would spend a couple of weeks every year traveling around to different villages to raise money. And that struck me. I was like, my dad didn't think anything of it. He's like, yeah, that's just what his dad did. I was like, wait, hold on. Why did he do that? Well, he did that because he was trying to raise money to build a youth hostel so that other kids could study in the village, right? And my dad just like moved on to something else. He didn't even think like that was a big deal. But I was like, wait a minute. So my grandfather, in the midst of bracing poverty, when he couldn't even feed his own kids, was going out and raising money for other kids. I was like, that's really striking. That's like there's something powerful in that. And when I asked my dad more, it turned out that other people in the village would come to my grandfather and say, you're so irresponsible. Like your own kids don't have enough food to eat, and you're going out and you're raising money for other people's kids. Like, where are your priorities? And that's where he would always pause, and he would just say, he was like, those kids are our kids too. Like, we've got to take care of them. And there was such a powerful lesson there for me that ties into this broader discussion around loneliness that we've been having, because it comes down to how we think about and define our responsibility to one another, our relationship to one another. Because I'll tell you, if life is really about each of us looking out for ourselves and just doing the most we can on our own and acquiring the most assets and wealth and accolades as we can, it's a pretty lonely life. But if life is really about taking care of each other and looking out for each other, of encouraging each other and being encouraged by others, of being lifted up by others when we fall down and lifting them up when they stumble as well, and then just seeing how incredibly far we can go together and then celebrate those milestones together, that sounds like the kind of life I think most of us would like to live. And so, all that to say, our parents' stories have great wisdom, but we have to often ask and dig for them a little bit. And sometimes it just takes one question, one prompting question when you're on the way to school with your parents, when you're taking a walk with them, when you're just sitting in the kitchen making dinner, when you're having dinner. Sometimes it just takes a few minutes to get a story that could give you wisdom for life.
Thank you so much, Dr. Murthy, for this valuable career and life insight. We will now begin the question and answer portion of today's session. Our directors, Darrell and Het, will be introducing the questions, and I'll pass it over to them.
Well, hello, Dr. Murthy. My name is Darrell, and I'm the Director of Programming of this conference for GHLC. So now we have a few questions from the audience to ask you. So first, we have a question from Emma from Virginia, and Emma will unmute and ask her your questions. Please go ahead, Emma.
Yeah, I think they had to leave. I think their internet dropped. But we do also have another question. Sorry, I didn't introduce myself. My name is Het, and I'm the Director of Admissions and Outreach for the conference. We also have a question from Mudupe, I believe.
Hello, Dr. Murthy. I'm Mudupe Oyelakin. I'm from London, United Kingdom, and in grade 10. So thank you for sharing your experience about how you got into medicine and mental health. I really enjoyed it. So my question is, what advice will you give to students who are interested or willing to make an impact in global health? And how exactly can we help or proffer solutions to issues we see around us?
Oh, well, Modupe, thank you for that question and for joining our session today. I'm so glad you're interested in global health. I think that a lot of the concerns that we are seeing with health are really shared across countries, and particularly what we've been talking about today, mental health challenges and the struggles with loneliness and isolation. These are becoming global challenges because they're features of modernity, unfortunately. And that, of course, is what more and more of the world is experiencing. So I think a couple of things I would suggest is, if you're interested in getting involved in a career in global health, is one, like, try to gather information from direct experience with those who need help and who need support. So you can read a lot about what the critical issues are, and I would encourage you certainly to study and read up on global health. But whenever you have the opportunity to actually have an experience on the ground, like listening to people, visiting different communities, trying to understand how culture and policy and economic forces intersect in shaping someone's life, that is incredibly valuable. There is nothing more valuable than those direct conversations. And to this day, I still rely on and think about the conversations I had with young women in rural parts of India when we were building our community health worker program. I still think about the students we work with in schools across the United States and Bangalore when we were trying to build a student movement to address HIV. I think about people who were impacted directly by HIV and other illnesses who I cared for in the hospital. These direct experiences really inform the work you do. So get close to the people you are seeking to serve. Get proximate. That is extraordinarily important. And then the second thing I would say is just to try things when it comes to the interventions. You may not know what the perfect way is for you to engage on global health. What's a perfect organization? What is the right path? Is it for you to become a medical provider, to be a policy person, to be somebody who focuses on the public health system? You may not know that off the top of your, right off the bat, and that's okay. It's actually really important just to start trying things, whether that's interning in an organization that's focusing on global health, or that's working with a public health agency in government or at a global level that's trying to shape policy. All those experiences are really powerful as well. And then finally, I would just recommend this too. If you have others in your life who are interested in global health, the more you have a small community of people you can talk to and bounce ideas off without fear of judgment or worry, that's incredibly valuable. This could be fellow students, it could be people a little older than you, could be teachers or mentors. But having one or two people like that in your life who you check in with regularly so they can help reflect back some of your thinking and evolution is really helpful as well.
Thank you for that amazing insight, Dr. Murphy. Now we have Emma back on the call again. So Emma, can you please unmute and you can ask your question.
Hello, Dr. Murphy. I'm sorry, I had to rejoin the meeting. But my question for you was, what part of your career or work has been the most exciting or meaningful to you?
Oh, that's a great question, Emma. And and don't worry about the tech issues. I fully understand those. We encounter this all the time too. There have been so many meaningful parts of it, but I think that the most meaningful elements of my work across the years has been the opportunity to directly interact with the people that I'm seeking to serve. Right. So in my various jobs, I've worked and been in offices trying to build like products. I've been, in offices, working on shaping policy and building public health campaigns. But it's a time where I've actually been on the ground, and that's happened either, in a few places when I was in the hospital taking care of patients directly. It happens now as Surgeon General when I travel around the country and have the chance to sit with people in communities and listen to them and learn from them and hopefully offer some support to them. Those are the most meaningful moments to me. And here's why. It's not only because it's gratifying to be able to provide some service and support to somebody right in front of your face, but I also just get so much from the interaction. I learn from those people. I learn not just about them, but they push me to think about my own life as well, to reflect on my own journey. And I find that enriches me as well. Like so many of the patients I mentioned earlier, who I've spoken to at the end of their lives, who are reflecting on what was most important to them, what they treasured the most, what they regretted the most. Those patients gave me a gift, right? Which is they gave me an opportunity to reflect about my own life as well and to learn from their wisdom about what truly matters, to not have to wait until the end of my life to recognize that what truly matters at the end of the day are the relationships we build, the love we give, and the love we receive. So those continue to be my most enduring source of gratification.
Thank you so much. I appreciate that.
Thanks, Emma.
Thank you so much, Dr. Murthy, for those insightful answers. And it was great having you talked to you today. And I just have one last question for you. So as part of our program aiming to develop the next generations of leaders in global health, public health, and medicine, and as the final speaker of our program this year, as this session comes to a close, we would like to ask, what advice do you have for these incredible students as they embark on their careers in global health and medicine?
Yeah, well, look, I've enjoyed the chance to be with all of you today. The only thing I would have liked more is if the universe could have conspired to bring us all together in person. That would have been wonderful. But I'll tell you that one of the reasons I was excited to talk to you today is because the world really needs you. There are great challenges that we're facing in the world, whether it's the mental health crisis, climate change, the growing polarization and division that we see, economic inequality. These are big issues. You don't solve them with a single policy. You don't solve them like in a single year. But they're issues that require us to lead from a place of clarity, and I mean moral clarity, right? Moral clarity to me is about what values are guiding us in the work that we do, right? And one of the things I think that has become really clear to me is that the movements that best support and sustain the world, that lead us to better places where we can all prosper, are movements that are fundamentally informed by a core set of values that include kindness and generosity, service, and friendship. These are the values that we need a new generation to resurrect and to strengthen and to reflect in the policies that we create and the programs that we build and the institutions that we create. And that generation has to be you, right? Because every major movement for change in history, whether it was the civil rights movement in the United States, whether it was the independence movement in India in the 1940s, like you look around the world at big moments when the world changed, and those movements were often led by young people. You don't find big movements led by people in their 60s and 70s. It's not to say they don't have contributions to add. But the reason I think young people have been key to leading the biggest movements in the history of the world it's not only because you're young and you have energy, but it's because you have the courage to think differently and to recognize that the status quo does not have to be the status quo forever, that we can and need to pursue change with urgency. So the courage and the courage to think differently and to act differently is a gift that has often been brought to the world by younger generations. And this is a time where we need you more than ever to help lead that moral reawakening in society and to then bring those core values that we talked about to the work you might do on global health, on economic development, on other aspects of how we live, including the climate change crisis. But that won't happen by itself. That has to be a conscious decision that you and your peers take to see these problems that are facing the world right now and to decide that we can be the solution that the world needs and the world desperately and urgently needs. So that's why I feel so passionately about all of you and what you are doing and what you can do, because I think that the future really depends, on your leadership and your insights. And don't let anyone also ever tell you that you're too young to make impact. We sometimes fall into this trap of thinking that you have to finish all your degrees, get some life experience, and then you'll be poised to make change in the world. That is absolutely not true, right? Again, history is full of people who didn't wait to make change, but who listened to the urgency of the moment, who listened to the inspiration that they felt in their heart, and who also listened to their own instincts and their own intuitions and said, no, I'm going to step up. I'm going to take these ideas that they have and I'm going to take a risk and try to make sure that the world gets better, that we address this critical problem in front of me. And that's what we need your generation to do. I was blessed because when I was growing up, my parents actually never told me I was too young to do things. So when I had harebrained ideas, when my sister and I wanted to build that nonprofit when I was 17 and she was 18, my parents didn't say, no, don't do it. They said, do it, just don't let your college work slip, right? And that gave us permission to continue. When I wanted to take a year off to do other things as well, like after college, and to build our nonprofit, expand into the United States and to study real estate investing, random things that I was just thinking about. My parents didn't say you're too young to do that. They encouraged me. I'm well aware that we all don't necessarily, we may have different types of parents. Parents may not always encourage us to pursue those things, which is why the last thing I would just encourage you to do is to be there for each other, right? Because these journeys that you're on to help make the world better are not journeys that any of us can do by ourselves. We're going to need support from each other. We're going to have moments of doubt where we're not sure if we're on the right path or if we have what it takes to get the job done. And that's exactly when we need each other to remind ourselves of our true potential, of our vision, of those moments of inspiration that we had, and also to remind us of what we should be chasing. That's what we started this conversation with, a conversation about, what are we chasing in life? For everything that is in front of you, for all the messages out there that tell you to chase wealth and power and fame and credentials, the one thing I suspect may lead to the most fulfillment is for you to chase service and contribution and love. If you have those things in your life, if you find ways to serve other people, the question you're asking yourself as you think about what to do this year and next year and in your career is, how can I best serve people? How can I take the problems that they are facing and actually address them? How can I make a contribution to the people in my life, to my family and my friends? And how can I make sure that I am as able to give love to others in the form of kindness and compassion as I'm able to receive it from others? That is a recipe for a life of fulfillment. And that's the kind of life that I also believe leads to those movements that truly make the world better. So I appreciate this time with all of you today. I'm so grateful for your interest in health and in service. And if there are ways that I can support this community going forward, you only need to ask.
Well, thank you so much for your extremely valuable messages, Dr. Murthy. This was a wonderful session, and we all really appreciated learning from you. It was an honor to have you as a part of our program.
Thank you so much. So good to be with all of you today. Yeah, take care.